Hello there, I'm Dr. Powell. In this video, we're going to talk about how young is too young to have a hair transplant, because this question has sparked a lot of debate amongst hair restoration experts. Male pattern hair loss can begin as early as the time that puberty ends, and it's estimated about 20% of men in their 20s have some significant noticeable hair loss, and the prevalence of male pattern hair loss only increases with advancing age. So you might be wondering, what exactly is the debate? If a hair transplant can have all these positive effects, and somebody who is suffering from hair loss wants to get a hair transplant, why not just go ahead and do it regardless of the age? But the debate just stems from the fact that hair loss is a progressive condition and that there is a finite limited number of donor hairs an individual has throughout their entire lifetime. A hair transplant cannot stop the balding process, nor can it create more hair. It just simply moves hair from a permanent region to an area where there's hair loss. The other part of the debate comes from the fact that the younger a guy is when he starts to experience male pattern hair loss, there is an increased likelihood or chance that he would have more advanced stages of balding. The debate is basically because of this very limited finite supply in the face of a potential large demand created by advanced stage baldness. And unfortunately, there's no physical exam, questionnaire, or test that can predict someone's future baldness. Nevertheless, a younger age is not an absolute contraindication to getting a hair transplant. Younger guys who have male pattern hair loss who want to have a hair transplant, the decision to do so should be made on a case-by-case basis. And if a hair transplant surgeon decides to go ahead with a hair transplant in a younger guy, he should use a more conservative approach and more conservative transplant design in these younger individuals. So let's take a look at a 25-year-old guy with some significant balding. The reason why I put this photo up is I want to bring up the other point with hair transplants in younger guys. Younger guys often want to have a more aggressive approach when it comes to hairline design. They often want to lower their hairlines to when what they remember what they look like when they're younger, rather than the conservative approach. So the conservative approach is the top line, which is what I recommended for him. And he was still considering lowering the hairline about a centimeter. We discussed the pros and cons of both aspects, and I informed him that because of his forehead shape and size, this could easily consume 1,000 donor grafts, which won't be available later on in life should he need them if his hair loss continued to progress. So he finally agreed to the more conservative approach, which I think is the absolute right decision. These are photos of the same 25-year-old guy, so which gives a more accurate depiction of the extent of his hair loss. So you can see here, we drew on the conservative hairline that's going to age well with him, but you can see that he's got significant loss in the temporal regions with signs of miniaturization around that as well. He also has loss in the midsection here, and on close examination he's got miniaturization of the hair there as well. So at this stage of his hair loss, medication like finasteride might give these miniaturizing hairs that you see here in the borders some life support and help them get thicker and grow a little bit longer, and allow him to hold on to them for a few more years. However, with these areas of loss, that's past the point of no return, and the only treatment option is hair transplant, because medication will do nothing for that. So in these set of photos, you're going to see a side-by-side comparison of the day of surgery with the conservative hairline drawn on, and this is only 5.5 months after. And this is a great example of somebody who is an early grower. I just want to point out that the hairline looks very natural, and even at this early stage of growth. The hairline is definitely much more defined, and closing off these corners also improved his profile. The other thing I want to point out to you is look at the contrast between his hair color and skin tone. That is something that needs to be taken into consideration when planning his hair transplant, because you want to avoid a very unnatural jagged appearance. You need to make his hairline design softer so it doesn't look so sharp and artificial. And this is a picture of his scar, again, only 5.5 months after the hair transplant procedure. So you see it's still a little bit of redness and a little puffiness. Again, the scar itself is very immature, and over the next several months it will continue to lighten in color. This redness will disappear and it will match the color of the surrounding scalp skin. Also, the scar will continue to mature and contract. You can see already that he's got hairs growing through this scar too, which will further camouflage this scar. The other reason why I'm showing you this photo is that, in my opinion, a strip procedure should be the only harvest procedure performed if deciding to do a hair transplant on a younger guy. The reason being is that you want to localize the damage to the donor area and not compromise the donor density should he require a repeat procedure down the line if his hair loss progresses. This is in contrast to a FUE procedure where the hair is harvested from a larger area and effectively thins out the donor density in any one particular area. And even if a guy who had an FUE as a first procedure switches to a strip procedure, their donor density is already compromised because it's been picked through and thinned out by the FUE procedure. Whereas a guy who had a strip procedure as the first procedure, the donor density above and below the thin scar is unchanged. So it won't affect their donor density and repeat procedures like a FUE would. Another point to discuss with a younger guy is the higher likelihood of the need for future procedures as the hair loss progresses. It is very important for the hair restoration surgeon to balance the present and future needs of all hair transplant candidates, and it is even more so when considering performing a hair transplant in a younger guy. A hair restoration surgeon will never put a younger guy in a bad situation if their hair loss progresses, as long as they adhere or stick to a conservative approach and hairline design. Well, I hope you found this video helpful. Please stay tuned for more videos in the future.